Hi and welcome. My name is Munirul, and in this video I provide highlights of a human rights report I published called State of Mental Health Rights in Bangladesh 2024. So let's begin. The human rights situation of individuals with mental health conditions in Bangladesh is poor. Laws are a powerful tool to improve their situation. In July 2024, I published a human rights report titled State of Mental Health Rights in Bangladesh 2024. The report compares mental health legislation in Bangladesh with international standards, using a guidance as a benchmark. The guidance is called Mental Health, Human Rights and Legislation and was published jointly by the World Health Organization and the Office of the High Commissioner of Human Rights in October 2023. The guidance is aimed at policymakers to assess and reform mental health laws in their country to meet international standards. The guidance draws heavily on the United Nations treaty called Convention on the Rights of Persons with Disabilities, or CRPD in short. It's important to note that Bangladesh ratified the CRPD in 2007. Here's how I created the report. I took 4 statutes and examined them using the guidance to see how they match with international human rights standards. The statutes were number 1, the Mental Health Act 2018, number 2, Persons with Disabilities Rights and Protection Act 2013, number 3, the Penal Code 1860, and number 4, the Code of Criminal Procedure 1898. An important disclaimer: only these 4 pieces of statutes were examined and not any other law, such as case law, rules created under these statutes, nor other pieces of statutes. I'm not a lawyer and this is not legal advice. I did a reading of the law from a layperson's perspective. If there are any errors in my interpretation, please let me know in the comments. Findings of the report. The findings were shocking to say the least. The laws are severely inadequate when compared with what the guidance suggests. The few laws that do exist, there are many that go against international human rights standards. Here is a small sample of the findings. Budgetary allocation. In 2022, 0.5% of the total government health budget was allocated to mental health care. This is not even 0.5% of the total budget. Criminalization of suicide. Although enforcement is not that hard of in the media, but Section 309 of the Penal Code still criminalizes suicide attempts with an imprisonment of up to 1 year with fine or with both. Involuntary hospitalization and treatment and substitute decision making. The Mental Health Act provides for the involuntary hospitalization and treatment of individuals for whom treatment is deemed necessary, but who refuses treatment. Individuals without guardians, relatives, or a home address are to be transferred to a mental health hospital. Minors can be forcefully admitted and treated against their will, with the only consent required is that of their guardian. Guardianship of property. The Mental Health Act enables administrators to manage the property of individuals with mental health conditions on their behalf. This is in contradiction of current international human rights standards. Focus on institution-based treatment. The Mental Health Act focuses on treating individuals in the hospital, which is in contradiction with the community-based model as suggested by CRPD. Outdated and derogatory terminology. Some of the laws, including the Code of Criminal Procedure, employs outdated and derogatory language, referring to individuals with mental health conditions using disrespectful and stigmatizing terms, such as lunatics, insane, unsound mind, undermining their dignity. It is clear that these statutes lack the majority of the essential provisions recommended for comprehensive mental health legislation. Here are some sample recommendations. A detailed list of recommendations can be found in the report. Comprehensive legal reform is needed along with comprehensive change in the mental health care system. The current legislation needs to be repealed, amended, and new legislation created until the legal framework in Bangladesh is in line with the current international human rights standards. The mental health care system needs to be reformed from the current institution-based model to a community-based system. Here are a few samples of the recommendations made in the report. This list is not exhaustive. Number 1. The mental health care model needs to be transformed from the current institution-based model to a community-based mental health care system and a crisis support system where individuals are treated in the community without coercion and where their human rights are respected. Number 2. More of the annual state budget needs to be invested into mental health care, expanding community-based and crisis support services. Crisis support services should provide non-coercive alternatives to forced hospitalization and forced treatment. Number three, health and social care workers, including hospital staff, needs to be trained in a human rights-based approach to dealing with individuals with mental health conditions. Number four, the current regime of forced hospitalization and forced treatment needs to be abolished. The right to informed consent needs to be respected for both adults and minors. Treatment of adults must only be done based on informed consent. For minors, informed consent should be obtained based on the child's maturity and age. Supported decision making should be made available for both adults and minors for making decisions. Number five, the current regime of substitute decision making regarding treatment needs to be abolished. Instead, supported decision making should be allowed that considers the will and preferences of individuals. Number six, laws needs to be created protecting privacy of individuals with mental health conditions and enforced consistently, holding perpetrators accountable. Privacy protection should cover a wide range of activities and domains, including but not limited to privacy of body, home, personal life, family life, digital life, and health-related information. Number seven, suicide attempts needs to be decriminalized by completely repealing Section 309 of the Penal Code. Number eight, discrimination in insurance needs to be expressly prohibited with penalties for insurers who discriminate. Number nine, outdated and disrespectful terminology in legislation, such as lunatics, insane, needs to be removed and replaced with person first, respectful, and non stigmatized language. Number 10, an ongoing awareness program needs to be created that educates the public on human rights of individuals with mental health conditions. Number 11, the right to access health related information from mental health services needs to be mandated. Number 12, it should be mandated in law that inpatients be allowed to communicate unhindered and unmonitored from inpatient facilities. In inpatient facilities, there should be access to information from the outside world through newspapers, radio, television, and the internet. Number 13, outdated and disrespectful terminology in legislation such as lunatics, insane needs to be removed and replaced with person first, respectful, and non stigmatized language. Number 14, laws needs to be created criminalizing hate crimes against individuals with mental health conditions. Number 15, it should be made mandatory for mental health facilities to make available to service users a list of their human rights. Number 16, it should be mandated in law that prescription of psychotropic drugs should be allowed only after the short-term and long-term effects have been described to the individual and after non-pharmaceutical and non-medical alternatives have been informed. Number 17, a system needs to be created for honoring advance planning documents. Number 18, the law needs to explicitly ban practices such as seclusion and restraint in the community. In healthcare settings, seclusion and restraint can only be allowed as a last resort to prevent harm to the individual or others. All cases must be documented for review by an independent monitoring body. Shackling in the community should be made a crime. Number 19, nationwide information systems needs to be created that will collect a wide variety of data related to mental health and mental health rights. Number 20, a fully independent monitoring body needs to be created that will monitor the human rights of individuals with mental health conditions and help hold human rights violators accountable and provide justice for the victims. Number 21, a code of conduct needs to be created for mental health professionals and hospital staff to hold them accountable for human rights violations. The code of conduct should mention penalties and have a complaint mechanism. Number 22, procedural adjustments needs to be allowed throughout the judicial process. Number 23, a code of conduct needs to be created for law enforcement and related entities and personnel. This is to ensure that law enforcement involvement meets human rights standards and human rights violators are held accountable. Number 24, justice involved officials such as judges, prosecutors, defense lawyers, law enforcement personnel, prison staff needs to be trained on the human rights based approach to dealing with individuals with mental health conditions for the proper administration of justice. This report was not comprehensive. A comprehensive research is needed to unearth all the laws related to mental health in Bangladesh. Then the laws needs to be examined to see whether they meet human rights standards or not. Then a full legal reform is needed. This should be done based on the Mental Health, Human Rights and Legislation, the guidance book. This video was just a highlight of the report. If you are interested in reading the full report, there's a link in the description below. Be sure to like and subscribe and click the notification bell icon. Stay tuned for more discussions regarding human rights in Bangladesh. Take care.